Okay. Actually, today I called you here to talk about a burning topic, something which is in the news. I think everybody is, there is a buzz going around. A very young lady, a celebrity, young means she's around 40 something. Of course, in the prime of her life, very successful, very health conscious, very beautiful. And then suddenly in the night, she's found dead. Just a few weeks before, I think she had a live session just like we are doing, and with her own husband, and they shared their feelings and thoughts, and then suddenly this news comes up. So it's a shocker. I think all over India, people are thinking, worrying about this. Few years ago, I remember that great singer KK. I just loved his singing and his voice. But
That's
then
right.
he was in a concert somewhere in Kolkata, and then suddenly we
Mm,
heard he's just 52 and he's passed away. Of course,
that's
there
right.
it might be a different reason. And then there was, I think, another actor in the south, Puneet Rajkumar also. Right.
Yes.
So all these events have been happening. So I just thought maybe you will talk a little bit on these things. Can you share your
Yes,
thoughts
sir.
on this? Yeah,
Yes, sir. Yeah.
it's good.
Yeah. Everybody was shocked by the news of Shefali.
Yeah.
Yeah, the and the model. So there has been so many speculations as to how she passed away. So
Mm-hmm.
from the news, I could gather that she was a known case of epilepsy. She used to get
Mm-hmm.
seizures, and she's been on medicines for epilepsy since the last 7 years,
Right.
is what I read from the news.
Right.
And also, there are so people are saying it could be related to the epilepsy.
Mm-hmm.
So, so,
Yeah.
but there are some speculations. Some people are saying that she was taking some beauty treatment and that caused some side effects, and that is how she passed
Oh.
away. So many speculations. But I
Mm.
just would like to emphasize something here. If she's actually a case, if she was actually a case of epilepsy. So there's some
Mm.
there's an entity in epileptic patients called SUDEP, that is sudden
Right.
unexplained death in patients with epilepsy, SUDEP.
Mm.
So
Mm.
I don't know if that is a reason for her passing away, but it could be one of the reasons. It's a very rare entity,
Right.
but there are some, it is actually seen in many patients with epilepsy, so it's a small percentage though. So
Mm.
the reason why a epileptic patient would die suddenly is not really known, but some studies show that during sleep, or during the, mostly it happens during the sleep, sometimes during daytime also, they might have a seizure. And
Mm.
after the seizure, there's a sudden surge of autonomic activity. That is, there
Mm.
is a sudden surge of hormonal or breathing. So
Mm.
they
Mm.
choke on the pillow or the bed, and then so these
Mm.
are the reasons for SUDEP. So Shefali, if she was a patient of epilepsy, this could be a reason. This could be like, it's
Right.
just the chances are very low, but then that is definitely there.
Yeah.
And then about the beauty products and the death. So I
Mm.
was just going through some articles, and then I couldn't find really a direct relation of these beauty products to any sudden death. Having said that, there are some injections which many models and many actresses take, which can
Right.
lead to liver issues and pancreatitis, hemorrhagic pancreatitis, and things like that, which can
Mm.
indirectly lead to a lot of health concerns, but not like
Right.
sudden death. I couldn't find
Yeah.
anything.
Yeah.
Yeah, and also about singer KK and yeah,
Mm.
Mr.
Mm.
Puneet Rajkumar. Like I think they have had uh, hypercholesterolemia, or like
Mm.
cholesterol
Mm.
levels. They're very strongly
Right.
linked to heart attacks, and many people, they might take medicines for
Mm.
BP or like sugar,
Mm.
but they say cholesterol, I think I'll try diet
Right.
control or I'll do exercises. But then it's very strongly linked to heart attack, especially the LDL cholesterol,
Mm.
which is the bad
Mm.
one. So maybe it was unnoticed in them, we don't really know.
Right.
So like the point that I want to emphasize here is, if you have cholesterol, especially if the bad cholesterol LDL level is high, then we should treat it.
Right.
And then once it is to the normal level, maybe we can carry on with diet and exercise. And about stress, like many people nowadays, everybody is
Mm.
stressed. They have work related
Mm.
stress, they
Mm.
have family related stress.
Mm.
So
Mm.
there is an entity called broken heart syndrome. I just wanted to
Mm.
emphasize that here. Syndrome, or Takasubo cardiomyopathy in like medical term. It means if
Mm.
you have like a very sudden stress or emotional stress, sometimes
mm,
physical stress also, it can cause a sudden surge of the activity to the heart. It's called
mm.
autonomic activity. So
Right,
it can also, the heart can stop or fail for temporarily, and
right.
sometimes if there's no medical help, patients can pass on. So
Mm,
broken heart syndrome is another cause.
mm, mm. Yeah, see, the thing is, the common point with all these three cases that we were discussing is that all of them are fairly young, right? Though I was surprised when I heard that KK was around 50 or 52 something, right? Which is, you can say, middle kind of age. That's the time when people do have heart issues, but he looks very fit when he was alive, and at that time, maybe he did something. We don't know actually whether they do something for
That's
their
right.
fitness and their looks because they are
Mhm.
performing on the stage. So they might take medicines or injections which make them look youthful, which
That's
is
right.
another thing that people are into, taking Botox
Mhm.
and so many other things, fillers and stuff like that, and they
That's
have
right.
an impact on health, right?
Yeah.
So the basic message is that looking youthful should be natural and as much as possible, and health should be the primary concern. So when you're doing any exercise or you're taking any medicine, it should be for better health rather than better or looks, right?
Looks.
What do you
Yeah.
say?
Yes,
Yeah.
sir, absolutely. But I think different people have different perspective. But yeah, health is important. Like I have heard people say that if you might have like 99%, 99
Mm.
problems, but if you have a health problem, then you only have one problem. So yeah.
For the as a last message, maybe you can tell something for the people who have epilepsy, right? Because being neurologists, we deal with them quite a lot, and so they might be worried when we talk about this condition called SUDEP. So, what are the chances
Yeah.
that an average patient would die suddenly of epilepsy, and the what precautions to take for these things?
Yeah. So, Sudhap, there's nothing much to worry. I mean, the epilepsy patient should not get worried or alarmed when I say, okay, there's a chance of Sudhap. It's very low. The percentage is very low. I could percentage. I'll have to check the literature. But then, it would be better that it's better to always be around somebody. Like if you are a person with uncontrolled epilepsy, don't live alone. Or like if you go to the bathroom or if you go somewhere, like make sure that you don't bolt the door. You don't lock it. And I mean, maybe if you have uncontrolled epilepsy, just refrain from dangerous sports or adventurous sports, swimming and things like that. And always like just have a companion when you are like when you're living, just have a companion or somebody around if your epilepsy is
Right,
uncontrolled. That is
right.
something, these are the preventive factors. So it's not a very common thing, so you don't have to be worried. Yeah.
Well, I think it's been great talking to you. Yeah, and I think we are getting calls from our other patients, so we might have to get back to our work. But I think it was very useful, and thanks for sharing your knowledge and information. And we'll meet again for further talks in on similar lines. Thank you.